With COVID-19 going across the globe, geospatial data has become a really hot topic. And it's always been a really interesting topic for me. In fact, years ago when I started doing some machine learning, dabbling in machine learning programming for medical information, including imaging, I thought naively that these programs could one day be great tools to enhance health in the third world, because I'd been a volunteer doctor in Haiti and a few other places. And what I eventually realized was that, in fact, there are really complex issues of how data is handled and data colonialism. And all of this is sort of bubbling up right now because of the COVID-19 epidemic, at least in my world. In order to discuss that, I decided to call my favorite programming brother from the motherland, AJ Smith. He asked me to say that. Unfortunately, we don't have a great internet connection because he's coming from Africa, but you know, I'm so happy I could have you talk to me and educate me on GIS and issues of data colonialism and what this all means in the days of COVID. So, like, for anyone watching, why don't you just explain who you are and how you got into programming?
Correction, we have great internet in South Africa, but I'm a cheapskate and I went for the cheapest data bundles. That's why we don't have a great internet connection. So yeah, so I'm AJ, I'm from South Africa, the motherland. I grew up in a really, really small town in near Cape Town. And I always have to explain while growing up, I always had to explain while traveling where the hell Cape Town is, because like people were just like Africa, no, the one next to it, not that Africa, so the one next to it. So I always wanted to like draw like where I'm from and put it on a map, and that's when I went to Stellenbosch University. I went to go study a degree in GIS, which is geoinformatics. Um, that's also where I fell in love with computer science and data analysis, and just like doing data driven exercises in general. So that's basically me. I've been working for the last 5 years as a data developer, but now I'm moving on to front end technologies, because I believe that if you can visualize something, if you can make something look tasty or sexy or more inviting to people, because we have the data, it's just that it's in a format that's not really appealing to the public. So
Well,
I'm running.
sometimes it is. You know, I actually yesterday was talking to a physicist who does machine learning programming, and he was so in love with the visualization they've made at Johns Hopkins of COVID. I mean, he just could not stop describing it as sexy eye candy. And I was like, yeah, but it's confirmed cases. It's just confirmed cases. You don't know anything about the different surveillance methods in these countries and what it actually represents. And sometimes I feel like you can make all of these sort of sexy data visualizations, but if you don't understand how people got the data, you still don't understand what it means. But we should probably not get into that quite so early. There may be someone watching who hears GIS and thinks, is that GPS? Is that thing in my car? Like, how do you study that thing in my car? I mean, people just don't know. Could you explain a little?
Yeah, so GIS is a whole department of sciences. So GPS is definitely a part of that family. But there's a lot more that you can do with GIS. There's the data collection section. There's the part where you transform your paper-based information into a digital part, a part where you look at this data, you say, look, this is the data that we got. What does this data mean? Who was the people collecting them? What biases did they have? That is part of the cleaning part of it. So the first part is collecting the data. or maybe digitizing it because there is a lot of data already available. The second part is cleaning it, and then comes the fun part, which is the analysis and the data visualizations. So an example would be a household survey, which the South African government usually done when there arises a problem, a question that they need answers for. Then they will do a household survey. It could be a travel survey, it could be something about discrimination, um, it could be like income based or like for social development. So these household surveys is part of the government. So different ways ranges of, and in each sector where GIS data can be useful or not so useful. It's just that sometimes we have this data, it's just that we don't know what to do with this data.
Right, right. And I think right now everyone is thinking about how useful GIS will be in terms of looking at COVID and infectious disease, COVID-19. Um, but what I wonder is how much data in general in GIS is public data and how much of it is sort of held by private companies. Because oftentimes the problem in healthcare is that institutions just want to hold on to data because they realize it's valuable. And so it's very hard if you want to create something that is accurate to get a hold of enough data. Is that the case with GIS data?
Yeah, that is usually a case, and especially here in South Africa, where well, I can't speak for South Africa. I can only speak for of my experience. Like especially when I've been involved in surveys where we have to go and collect data. Usually there's only a budget to collect a sample size, and then that sample size is then scaled up um, to the entire population. Sometimes, but we use different kinds of methods then to scale this data up, and that is usually backed by stats. But in general, the data is not as accurate as one would think it is, because even with the surveys, with the household surveys, when you go and ask, when these surveys go to these different houses and go ask these questions, sometimes someone writes something and it looks like an A when it when like a spelling error could change the entire word. Say someone um, a good example would be, say someone is working in the house. So one of the questions could be like, how many people are actually living in this house and how many people are working? And how many people are infants? So a person with really bad handwriting could write for the first question, how many people are working? It could be 7, when they actually meant to write 4. And then the second question is how people are living in this house, could be like 6. And then these numbers doesn't correspond because now there's more people working in the house than actual people living there. So these are all of the data that we lose during the collection phase, because then that data is invalid because you don't actually know like which one is the correct one. So it's best just to either you can follow up in that regard. You have two choices. You can either follow up with the people if you have the contact details, or you can disregard that data set. So the samples then get smaller, and then because the sample gets smaller with each iteration where you look at this data, it kind of gets when you scale it up, if there's biases across the smaller population, it then scales to the bigger population, and then it looks like the bigger population has this certain idea of who and what, and yeah.
Yeah, it's funny. Believe it or not, I've seen everything you're talking about in parallel in health data. I mean, uh, I don't know why people in the modern world with computers even collect data by hand in health, but it happens more than you would think. Um, so let me switch gears and ask you, how is the COVID situation going in South Africa, COVID-19? Do you think that in general the population is aware of where it is? Are they looking at maps of where it is? Are they
Uh,
actionable maps for people? How are people responding in general?
So our government is actually they're very responsive in terms of COVID. They have an official website where they're sending out information of confirmed cases per province, where these people travel to. It's like some form of identification, like is it a male, the age group of the people, and also that. There's been collaboration amongst different developers and companies where they are building open source tools on it. There's a map, I think it's Corona SA map. I'm following it. They actually pull this data from that the government makes available, and they're actually displaying it in on a heat map. Now, I'm not going to go into the definition of a heat map, but it just shows the different kinds of confirmed cases that we have. Um, but it's a scary time. In here, everyone's kind of panicked. They've closed down a lot of non-essential stores. We're going on lockdown on the 26th, and then uh, I don't know what's going to happen next. But
Right.
there is some involvement in there, and there's also a lot of so the data that the government own um, is available to the public under certain rules and regulations. So these data can be accessed, and there's actually a team of people that actually have made like where the hospitals are they've identified who is like the population that's going to be most impacted, like the old people, people with diseases, and people with like compromised immunities. They've identified these groups of people, and it's like the entire country is not the entire country, but like there's some key stakeholders that's working with government to get this to get government more informed. So I think there's really great things happening in South Africa. Also, the government has implemented a lot of business aid. So like if you have a company, and like there's a lot of things that they've put in place to then help companies. And but it's we'll see on the 26th how it all plays out, because I'm not sure how we will enforce the lockdown, because people are still not actually locking down. They think in what I would like perhaps someone that's watching this video to know is that we are living in an evolving society, and what is important today may not be what's important tomorrow. But what we can do is we can collect this data. We can study the patterns of how people move, where they're moving, and we can start asking the questions. Why are they moving in this way? Why is in this location? Why are they clustered together? Why are they? Why is the spatial densities different in location X than in B? So once we have this data and once more people understand it, we can start asking these questions. And then these questions, I believe, will take us into the future. I mean, like if we look at not just COVID-19, but other infectious diseases, if we could track where did HIV start, how did it spread? If we had all of these data, we can start asking the questions. Um, what where did it start actually?
Right.
Because
Well, I think people have different hypotheses, but you know, at the end of the day, with some of these diseases, it's not entirely clear how certain we can be about that. But you make an amazing point. We really don't know what data will be important in the future. We only know that retrospectively from the data we already collected. So maybe we should be collecting even more data and sharing even more data.
yeah, because the question that we're asking today might not be the answers that we need tomorrow.
Totally.
I mean, like when we saw the GPS, who would have thought that we would use GPS to bring food to your door?
Right, right. Wow.
So
And I'm sure there are things we'll see in the data and discover that nobody expected. So maybe in terms of planning for disease, there are questions we're not asking now, but we could ask in the future when we look back at this data about how this latest pandemic went around the world.
Yeah, there's definitely lessons to be learned. And I think because we are trapped within the situation, we are not equipped to ask these questions, because it's usually when you're outside of it, then the questions come. But I think it's really important that we do start collecting data and storing it in an accessible format. And then as the format changes, like programming languages change, we also update these data that has been collected. So yeah, I do believe that data collection is really important, and also encryption, so that we can sell the data tomorrow.
Right. And also maintain people's privacy around health issues. Like, encryption will be vital until, of course, we come up with some super quantum computing that can do a lot more and just break through encryption, right? I mean, you tell me.
Yeah, I wrote a paper when I started when I was in school about what we need, if we needed a encryption or if we need more storage. I think if we're looking at storage, we're going to run out of data warehouses. We'll probably go and store data on the moon or on Mars, maybe, and build a supercomputer there,
Oh God, and
or
back to Mars, where, this is where I just part ways with this is how you can tell who's a true tech person and that I'm not a true tech person. You people want to live on Mars and I'm just trying to stay alive on this planet. Like, I guess you'll be laughing at me from Mars.
no, I'll be studying data. I won't be laughing. I'll be doing analysis, GIS analysis. So it's just
You're amazing, AJ Smith. You're already planning what you're going to do on Mars and your new GIS analysis for Mars. Are you serious?
yes. I mean, like if you look at the first 5 MB that was stored, it was like this huge. Um, I think it was bigger than a normal fridge. Like two people had to it had wheels, but now you can store 5 MB. What is 5 MB? It's a big picture in modern day society. So the encryption is getting better, but also the data collection is getting better. So I think at some point we need to move over to looking at the data, asking who does this. We need to work towards the future, which is asking the questions: how
All
can
right.
this data help to improve the average human or alien life on Earth?
Okay. Well, I have to go, but hopefully you'll be able to look back at this when you're living on Mars as a Mars GIS specialist and remember me, the outdated old school techie who died on Earth. All right.
Yeah.